Time now for this week's Health Matters. Paul Critz with you, along with physician assistant Lynn Szabo. And we're not alone in the FUG house today. Who's our guest here with us today, Lynn?
We have Crystal Yang here. She works for the Public Health Department. Tell me exactly what part of it.
Hi, I'm Crystal Yang. I am the Health Education Coordinator for the Tobacco Use Prevention Program.
TUPP. TUPP. How long has TUPP been around?
Oh, we've been around for a really, really long time.
Yeah,
I'd say
yeah.
around like 20 years or so with the county. Yeah.
Wow. I guess this smoking craze with the kids, it isn't going to go away anytime soon, is it?
Or anybody.
I hope it would.
Yeah, that would be nice.
So would it just before I'm always kind of curious to hear these numbers. Just before we dive in, for a question for either of you, what's the smoking rate just among the general population in Del Norte?
The general population in Del Norte, I believe it's around 16% among smoking among adults.
Okay.
Yeah.
Okay. And any guidance? How does that compare with the state in general?
The state, I believe, is around 9-10%.
Yeah, that's about what I thought. Yeah. That's lower than I thought. I thought we were up in the 20 percentile for a while.
I think we have.
We were.
Sure.
Yeah, but it's come down a little bit in the last few years.
Wow, fantastic. So what is TUPP involved with? This is we were talking before off microphone about this is back to school season and getting ready to get back in and remind the kids in Del Norte Unified School District not to smoke. How's that going?
Well, a lot of what my staff and I do is community outreach and education around the harms and risks of tobacco use. Mm-hmm. And we also help run community coalitions like the Tobacco Free Del Norte Coalition and the Storm Youth Coalition. And so we really try to advocate and educate people on why tobacco and nicotine use is harmful, right? And a lot of that has to do with primarily education and prevention. And now with the school year rolling around, we're hearing a lot about, how youth in the community are vaping, using nicotine pouches, how prominent nicotine use is among our youngest population. So we really want to try and prevent that. We want to try and, help our young people to not get addicted to nicotine.
Right. So they use the patches?
Pouches.
What's a nicotine? I misunderstood. What's a nicotine pouch then?
So have you heard of Zyn?
No.
So the nicotine pouches, have you heard of chewing tobacco?
Yeah, sure.
Yeah, so nicotine pouches are a type of smokeless tobacco. But they don't contain tobacco leaves. They're made of nicotine salts, and they look like a little tiny tea bag, like a small little white baggie. And they come in these containers, like a round canister. If you go into a store that sells tobacco, you'll see them on the shelves. A really popular brand is Zyn, Z-Y-N.
Wow, okay.
Yeah,
okay.
And
is it oral? Is it supposed to be
oral,
like
yeah,
wow.
It's not a combustible. It's advertised as tobacco free, so no tobacco leaves, but it has a lot of nicotine in it.
That's so wild.
Yeah,
That's evil.
Yeah, and
evil.
It's beginning to become very popular among our young population. So that's the new big thing that we're starting to see lately. Aside from vaping still being very common among our young population.
It's almost like there's a whole industry that exists to kind of deliver
right?
all of that.
Oh my goodness.
Wow, I've never heard of that. I did not know that was a thing. They keep coming up with new ways to do this.
Yes,
wow.
It is ever evolving.
And younger people.
Oh, yeah,
I have seen in my exam room 5-year-olds who admit to smoking. This was before vaping. But I see the junior high school level as being like the on-ramp to the smoking highway. It's
there was a survey by the California Department of Public Health that showed on average teenagers are vaping as young as 13. And, you know, we've heard from our local community, like people who approach us at outreach events. You know, we've heard people say that they've started as young as 9 years old. So yeah, it's a big problem.
So besides just community out, and I don't mean to say just community outreach and the kind of passive sort of education. So TUPP has been involved also with trying to get ordinancing as far as governing in like rental properties, smoking, tobacco use, but also the sale of tobacco in city and county here. Can you recap that whole thing, just as far as the push for the ordinancing, the selling, I guess, first at the county level? Was that the first sort of clash with local government, or at least, you know, interface with local government to
I mean, we have some awesome coalition members who have been advocating for, you know, for more tobacco related policies in our community. And they've done some really awesome jobs throughout the last few years. They've advocated for smoke-free multi-unit housing, which now protects tenants from secondhand and third-hand smoke exposure in both jurisdictions of our county. And we also have tobacco retail license ordinances in both our city and county. And that has taken several years to accomplish. You know, we had a couple years ago, we had some youth in our Storm Youth Coalition who spoke up and shared their experiences with youth, you know, with their peers vaping, and how they've experienced vaping at schools and around them among their friends, and just, you know, people like that they hang out with, that they see every day, how vaping in bathrooms have affected their school lives, and that
how easy it is to get.
Right, how
you
easy.
have some statistics here that are shocking.
Right, yeah. And so that has led to our local decision makers to pass or to adopt the tobacco retail license ordinances that we have now, which hopefully will lead to protecting youth access to tobacco products.
And it's way too soon to even hope. Is it even possible downstream to sort of keep an eye on things and see if these local ordinances impact local underage tobacco use?
I really hope so. You know, my team and I, we recently did a young adult, it's called a young adult tobacco purchase survey. It's very similar to decoy stings, right?
I was going to say that. Are you standing outside the thing?
Yeah. Yeah. But the only thing is we're not law enforcement, so we can't, you know, cite anyone who has a violation. So basically what we did was we hired and trained a young adult and had them go into tobacco retailers and or stores that sell tobacco, and had them try and purchase tobacco. And of the 18 stores that we went into, 6 of them sold to our underage decoy.
Wow.
Yeah, and after that we went and we contacted all of the 6 owners and let them know what happened. We trained their staff.
Oh, wow.
And we made sure that we followed up in terms of, you know, letting them know, like, hey, this is what happened. These are the laws that were violated. These are the laws that were violated. And, you know, this is what could happen to your store if this were to ever happen again.
See, now, if I were a store owner, I'd be grateful to have something like that happen.
Yeah,
right?
and they were. They were very cooperative. They were really grateful that they received education versus a citation.
Exactly,
right?
Exactly.
Were they shocked?
They were.
Yeah.
They were
Oh,
very
that's
shocked that
interesting.
their employees had done that.
Wow.
Interesting.
I get this is a bigger question. It just seems to me it's almost like unfair, you know, to tack onto the role of some retail clerk at a store like that they have to police all of these things and try to tell if somebody, it just seems, I know they have to do that with all sorts of products, not just tobacco. I know that's part of their job.
Right.
But it just seems like it should be more restrictive, just the availability in general. Like you should have to go to a tobacconist or something,
Oh, that'd be cool.
Wouldn't that be cool?
That would be cool. That's probably a thing in other countries.
I think it is.
Yeah.
Right.
Yeah.
Yeah. And our tobacco retailers, they're or stores that sell tobacco, they are that first point of contact for these people who are buying tobacco.
Yeah.
So I would really hope that they do follow
Yeah.
these laws, because they help to protect the youth access, and they have that role and responsibility.
As the struggle over whenever we're going back and forth, I remember this at the Board of Supervisors specifically, where it seemed to be a bigger issue, going back and forth about the selling ordinances. I don't think a lot of people understand when they walk into a situation like that and step up to the counter, just all of the intentional acts that are going on all around them, as far as the advertising and the things that are meant to catch your eye and to get your money, and that children stepping into that are just guileless and have to, but most people are, I think. And that's what I remember coming out of the debates in front of the, the coalition stepping up and talking to the Board of Supervisors, that there's a very real conscious effort to sell tobacco to underage people, or at least to people adjacent to underage people. And it's happening purposefully all around.
Right.
So you can't just sit back and go, oh, we're just going to let the market take care of itself. The market's trying to get us all to smoke.
Yeah.
So
Yeah, exactly.
So I think that just that kind of the assumptions that go unspoken in a situation like that, when you walk in and you don't realize that, there's a reason this poster is this high in this position right here.
With these colors.
Yeah, exactly.
Yeah.
Right.
Exactly.
And that the product has these flavors.
Right. It seems like such a daunting task, Crystal. How do you stay focused and motivated? I guess because there's always something to be done, right? But yikes. Well, I was thinking in the back of my head as I was asking the question about downstream like metrics, as far as, if these ordinances have an impact on underage tobacco consumption in Del Norte. You've got so many other factors influencing that. How can you even track that? How can you hope to track that? That one thing, the ordinance that's going to change something. It just seems like it's such a daunting thing.
It's definitely difficult.
Yeah.
So
What are there key difficulties you experience just being in Del Norte? What are the difficulties that you come up against?
I feel like we're in a very unique position, like location wise, right?
How so?
Because, for example, we have the flavor ban, the California flavor ban, right? Which essentially bans flavors from being sold in stores that sell tobacco. But here we have stores on reservations that are still selling flavors.
Wow.
And we have stores in Oregon that are just 20, 30 minutes away.
Yeah.
And so it's still very easily accessible to obtain flavors. And that's just one example, right? So I think we are, our challenges are different from somewhere, say, like, a little further south. So it's,
I have a question about the pouches. Do you need a spit cup with that? And here's why. That seems to me to be insidiously under the radar.
Right.
Maybe intentionally.
Yeah.
And I think a kid, if you don't need a spit cup, you could still look cool at school without any parental or teacher awareness of what was really happening.
Tobacco free, that being on the packaging. Tobacco free when it's nicotine salts.
right.
Good Lord.
I think as far as also my big issue in the exam room, because I've been doing tons of sports physicals and tons of well child checks, I always ask about tobacco use down to age 5. And usually parents are shocked. Kids don't know how to answer, but a lot of them will answer truthfully. And I guess the bathroom thing at the middle schools is a huge, big deal for kids. A lot of kids who don't smoke and don't need the bathroom break to go vape or something, don't really have access to the bathroom because they don't want to be around it.
Oh my God.
It's a huge big deal.
You're going to have to have, like in middle school, like non-smoking bathrooms.
Yeah,
First off, what's this whole
there's
thing?
a lot of problems with the bathrooms.
There's a whole
beyond that.
bathroom system going on, right?
But right now there's a new system at one of the schools where one has to request permission online, and then they get back to you. There's no more than 5 people allowed in the bathroom at a time, which to me seems like a lot.
In real time in class, they have to ask online?
Yeah, they've got a way to sign on to, I don't know if it's an app or if it's, part of their laptops or what. And there's but this is weird. Somebody's monitoring that not only online, but also in the hallway. And they're just starting this in one of the schools. And, there's a lot of shenanigans that go on in the bathroom. But I think that this is their primary target. Have you heard anything about that?
About the bathroom?
About the new bathroom system?
I have not. I mean, and we're in the first week of school.
Right.
Right. Yeah. So I haven't heard about the bathroom
I think it's a little
yet.
bizarre, but
Yeah,
maybe
that is
sadly
very
necessary.
That they're targeting having to cut back on bathroom access or regulate bathroom access because of
Yeah.
smoking at a middle school?
Yeah.
Yeah.
For a lot of reasons.
Right, well, yeah, there's
it's
not just smoking, yeah.
but smoking's probably the top reason.
Yeah, no.
So
the reason's middle
convenience.
school kids is what it is.
Right, there you go.
That's
You
the
got
reason.
it. But I think it's weird there's an app for that.
Yeah.
Or however they have it set up electronically. Like, I don't know, my daughters went to a Humboldt County school, charter school, so they were, they could wander
Little different
anywhere.
experience, yeah.
And I think it's a little sad. I think the kids lose a little bit, like personal responsibility about going to the bathroom. But
Yeah. There's all kinds of things going wrong at middle school.
but it's so hard, do you respond with a really heavy, forceful response, or do you try and reason that with a kid who doesn't have a full frontal lobe?
Yeah,
for,
right, exactly.
Another 12 years. So
Yeah.
it's hard. I like to, in the exam rooms, if somebody comes in and maybe they've they have an upper respiratory infection. I'm talking about a kid, or they got a burn, and they'll say, "How long is it going to be before it heals?" And then my first question back to them is, "Do you smoke?" Because that makes a difference in this clinical situation, and they always look shocked, and the mothers look shocked. But I force a time where information can get planted in their head, even if it's a little seed, so that there are bad outcomes with, smoking or vaping.
Right.
And the reality is this is going to change the way you heal and the way your body works. And you might not notice that in the next 10 minutes, but you will eventually notice it. So
That's an interesting sort of dynamic to attack too, in that you're taking, because smoking, I remember smoking is a very personal thing, right? It's just you, and then now, I guess maybe that's part of the struggle with even public outreach and education is to show people this thing that you think is first off, it's detrimental just on a personal level, but it's also detrimental on all these other levels, meta levels and interpersonal levels, and it just hurts you in every possible way.
It goes in thousands of directions. And it's denial is like where people who smoke live, I think, a lot.
Well, yeah.
Yeah.
So, Crystal, for TUPP and the various coalitions and syndicates, I don't think that's the right term, but we'll get the Bunko Squad in here if we. What's happening? We're just starting in the school year. What's coming up? Like, what sort of new pushes do you guys foresee in the coming year?
Well, we would really like to try and educate parents a lot more about the harms and effects of nicotine addiction, especially for youth. They're still young, their brains are still developing, and nicotine has such a detrimental effect on our youth. So we really want to try and prevent them from even starting in the first place. So we want to encourage our parents to try and learn as much as they can about vaping, about nicotine pouches as much as possible. And they can check out our website, to find out more information about that. At the moment, if anyone is interested in, participating in any of our coalitions, whether they're an adult or whether they are a youth, over the age of 12 and might want to, contribute to their community in terms of trying to fight against tobacco, they can also reach out to us at our website.
So because we were talking also beforehand, the Storm group at the high school, everybody graduated. So it's like, right? I mean, you said that everybody graduated out.
Oh, those guys were cool.
Yeah, I know. That was like,
Yeah.
And then they gotta go on with the rest of their
we're
lives.
We're going to try and recruit some new members this year. We're hoping to maybe put together some type of a youth summit to educate middle school students.
Wow,
is kind of our new project this year.
Is that a new focus? That age
is.
group? Yeah.
Yeah, we're thinking, maybe we need to start educating younger because, like we were discussing earlier, we're seeing it at a younger and younger age. So we really want to try and get our kids while they're younger and educate them more.
Is there a secret to dealing with a kid? If you're educating a bunch of kids, you're telling them what's going on with smoking. How do you get past that level of interaction with an issue and get into the heads of the parents?
I don't know if there's a secret. I mean, yeah, I wouldn't say there's a secret.
Okay.
Yeah.
Is it just a matter of just getting enough of the message out there often enough that it kind of pervades?
So, yeah.
Yeah. Okay. Because that seems like, the kind of smoking that you've talked about encountering in the exam room with kids, Lynn, it seems like the parents would have to play a big role.
Oh yeah, the kids rat their parents out immediately.
Right.
Yeah, I say don't be around it, and they'll immediately look at their mom, who's squirming in the corner, kind of. Yeah, and it's a good moment to pick up, even though technically she's not the patient, but to use some of the resources they have for the Native community, and offer those up, or 1-800-NO-BUTTS, 1-800-NO-CHEW, is there a 1-800-NO-VAPE? I wouldn't be surprised.
So the California quit
Super
line is
important.
Is actually Kick It California. So they have a website, kickitca.org, KICKITCA.org now.
And people are resistant to that, but it is the step. I think it's the first step. And it doesn't mean that somebody is going to make you feel bad and try and get you to quit next Tuesday. It's like they'll give you some options. There is an increasing amount of medication for adults that could be used to help in people stop smoking, and more than just nicotine replacement vehicles, but things that quiet that little voice in your mind that's going, now, I need the nicotine now. And that is, for most insurance, that's where you start in order to get access to those. Also, I think they're a little, when you're talking to one of those counselors, they're a little bit tailoring a program for you. So it's not like it's just you do ABC. It's like, what are your triggers? What's your insight into this? How do you think you might best approach this? So you know what? This would work perfectly for that.
Right.
So yeah, it's super helpful. And a lot of times, well, not only they have the data to suggest the counseling lines are increase the person's ability to actually quit for good. So it's a really good, easy start, especially somebody who's thinking about like a New Year's resolution. Now is the time to start thinking about that. Not 10 minutes to 12.
You need to make it. Yeah, exactly.
Yeah.
10 seconds.
You got to like plot out your journey.
Right. And it's got to become a big, like epochal sort of moment in your life that you build up to.
Right. That's what you said off mic earlier, is that I asked you how long you had thought about it. And you said like a decade.
From the first cigarette I smoked, I thought about quitting. Yeah.
Right. And so this is a way to get traction and organize meaningful change that's going to lead to smoke-free. So,
and I know there's a tendency, and even I exhibit it sometimes, to just go, it all comes down to like, personal choice and willpower and all of that. But I found in my own journey that it was very, very helpful as California, and it, in the time that I smoked, when I started, and when I started smoking way back in the good old days, you could smoke anywhere. And from the time when I finally got to the point where I quit, California and municipal ordinances and things that curtailed that ability to smoke anywhere were very helpful, because by the time I had children, I'm not smoking inside. Because I couldn't smoke in a bar anymore. I couldn't smoke in a cafe. I could barely smoke walking down the street. I'm certainly not going to smoke inside. So when it came time to actually quit, or even after my children had grown and like left, I still didn't smoke inside because it was my house. I'm not going to smoke in it. Just kind of the ordinancing and the changing sort of socio I guess law, the ordinancing sort of scenario, the context really helped by curtailing that. It was like, then when it came time, I'm like, I'm ready after all this time, since I can't smoke anywhere anymore. I guess I'm ready. It was much easier than the times that I tried and failed in the past, when I'm sitting in a room that still smelled like a cigarette trying to smoke. It was a big difference. So those things like the tobacco ordinancing and the tertiary smoke ordinancing and the rental properties, those really make a difference, just by changing the physical milieu in which all these choices happen. So I don't know. I'm all for that. I'm all for curtailing the market and saying, no, you can't smoke in that rental property. I do understand that. I do get that. And it isn't just it also, the flip side of that is it doesn't make the difficulty you have in quitting like a personal failing, because there's all these other things.
It should never be seen like that.
Right.
And I think probably 11, 12, 13-year-olds that they're surprised that they're stuck in this. They did not see that coming.
Yeah, whoops.
Yeah, no frontal lobe, no ability to see that. And somehow you think you're, I don't know, immortal or something.
Well, yeah.
And it's your parents' failure to do something just means that, that has nothing to do with your ability to do something.
Right.
And I think they get shamed into it, which is kind of sad.
Like they're trying to fit in right now. They're getting peer pressured right now.
And they think, okay, I'm just going to do this, for a short period of time, and then it's going to be out of my life. But correct me if I'm wrong, vaping harder to quit than cigarettes? Or does it really matter?
I don't think it really matters, because they both lead to a nicotine addiction. I mean, for young brains, all it takes is 5 milligrams of nicotine a day to get addicted. And for reference, a vape product, like on average, has about 20 milligrams of nicotine in like one vape device. And a cigarette has about 10 milligrams, but only 1 to 2 milligrams is inhaled.
So we've got 2 minutes. We just got the sign. What thing needs to be said that's not been said?
So,
there's a reason I don't say it, Lynn, but that's
I'm not sure she saw it.
So, I guess to wrap it all up, oh my goodness. Yeah, that just like put the whole spotlight on me. It doesn't really, I don't think that whether it's vaping or cigarettes, nicotine pouches, it's all nicotine. It's, at the end of the day, it's another way to get addicted, and for young people, I don't even know if they know that they're getting themselves into this lifelong addiction.
Yeah. They just want to be cool.
Yeah.
Well, Crystal, keep fighting the good fight. Thank you very much.
Thanks for coming on.
Thank you for having me.
So once again, the website is tobaccofreedelnorte.org. If you go there, there's a picture of Denise Schnacker right on the front. I see her there at an event. It has numbers and all sorts of stats and things and ways to get involved and to put your shoulder to the wheel of trying to get kids to quit smoking, to not even start smoking. That's the easiest
Even
way to do
better.
it. Yeah. I know from experience that's the easiest way. Crystal, thank you very much for coming in today.
Of course. Thank you so much.
And Lynn, thank you. Any idea about next week?
Hospice, coastal hospice.
Okay.
Would
All right.
hear about them.
That's on the next Health Matters. Thank you, Lynn.
Mm-hmm.